Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
181. A nurse is caring for a client with acute pancreatitis who has a history of alcoholism. The nurse closely monitors the client for paralytic ileus, knowing that which assessment data indicate this complication of pancreatitis. 1. Inability to pass flatus. 2. Loss of anal sphincter control. 3. Severe, constant pain with rapid onset. 4. Firm, non-tender mass palpable at the lower right costal margin. Answer 1. Rationale. An inflammatory reaction such as acute pancreatitis can cause paralytic ileus, the common form of non-mechanical obstruction. Inability to pass flatus is a clinical manifestation of paralytic ileus. Loss of sphincter control is not a sign of paralytic ileus. Pain is associated with paralytic ileus, but the pain usually presents as a more constant generalized discomfort. Pain that is severe, constant, and rapid in onset is more likely caused by strangulation of the bowel. Option 4 is the description of the physical finding of liver enlargement. The liver is usually enlarged in the client with cirrhosis or hepatitis. Although this client may have an enlarged liver, an enlarged liver is not a sign of paralytic ileus. 182. After performing an initial abdominal assessment on a client with a diagnosis of cholelithiasis, the nurse documents that the bowel sounds are normal. Which of the following descriptions best describes this assessment finding? 1. Waves of loud gurgles auscultated in all four quadrants. 2. Soft gurgling or clicking sounds auscultated in all four quadrants. 3. Low-pitched swishing sounds auscultated in one or two quadrants. 4. Very high-pitched loud rushes auscultated, especially in one or two quadrants. Answer 2. Rationale. Although frequency and intensity of bowel sounds will vary depending on the phase of digestion, normal bowel sounds are relatively soft gurgling or clicking sounds that occur irregularly 5 to 35 times per minute. Loud gurgles, bobrigmi, indicate hypoperistalsis. Bowel sounds will be higher pitched and loud, hyperresonance, when the intestines are under tension, such as in intestinal obstruction. A swishing or buzzing sound represents turbulent blood flow associated with a bruit. No aortic bruits should be heard. 183. A nurse is assigned to care for a client with nephrotic syndrome. The nurse assesses which important parameter on a daily basis. 1. Weight. 2. Albumin levels. 3. Activity tolerance. 4. Blood urea nitrogen (BUN) level. Answer 1. Rationale. The client with nephrotic syndrome typically presents with edema, hypoalbuminemia, and proteinuria. The nurse carefully assesses the fluid balance of the client, which includes daily monitoring of weight, intake and output, edema, and girth. Assurance. Albumin levels are monitored as they are prescribed, as are the BUN and creatinine levels. The client's activity level is adjusted according to the amount of edema and water retention. As edema increases, the client's activity level should be restricted. 184. A client is being admitted to the hospital with a diagnosis of urolithiasis and ureteral colic. The nurse assesses the client for pain that is 1. Dull and aching in the costovertebral area. 2. Aching and cramp-like throughout the abdomen. 3. Sharp and radiating posteriorly to the spinal column. 4. Excruciating, wave-like, and radiating toward the genitalia. Answer 4. Rationale. The pain of ureteral colic is caused by movement of a stone through the ureter and is sharp, excruciating, and wave-like, radiating to the genitalia and thigh. The stone causes reduced flow of urine, and the urine also contains blood because of its abrasive action on urinary tract mucosa. Stones in the renal pelvis cause pain that is a dull ache in the costovertebral area. Renal colic is characterized by pain that is acute, with tenderness over the costovertebral area. Options 1, 2, and 3 are not characteristics of urolithiasis and ureteral colic. 185. A nurse is assessing the client with left-sided heart failure. The client states that he needs to use 3 pillows under the head and chest at night to be able to breathe comfortably while sleeping. The nurse documents that the client is experiencing 1. Orthopnea, 2. Dyspnea at rest, 3. Dyspnea on exertion, 4. Paroxysmal nocturnal dyspnea. Answer 1. Rationale. Dyspnea is a subjective complaint that can range from an awareness of breathing to physical distress and does not necessarily correlate with the degree of heart failure. Dyspnea can be exertional or at rest. Orthopnea is a more severe form of dyspnea, requiring the client to assume a 3-point position while upright and use pillows to support the head and thorax at night. Paroxysmal nocturnal dyspnea is a severe form of dyspnea occurring suddenly at night because of rapid fluid re-entry into the vasculature from the interstitium during sleep. 186. The nurse admits a client who is in sickle cell crisis to the hospital. Which does the nurse prepare as the priority in the management of the client? 1. Pain management, 2. Fluid administration, 3. Oxygen administration, 4. Red blood cell transfusion. Answer 3. Rationale. The priority nursing intervention for a client in sickle cell crisis is to administer supplemental oxygen because the client is hypoxemic and as a result, the red blood cells change to the sickle shape. In addition, oxygen is the priority because airway and breathing are more important than circulatory needs. The nurse also plans for fluid therapy to promote hydration and reverse the agglutination of sickle cells, opioid analgesics for relief from severe pain, and blood transfusions to increase the blood's oxygen carrying capacity. 187. The nurse suspects that a client who had a myocardial infarction is developing cardiogenic shock. The nurse assesses for which peripheral vascular manifestation of this complication. 1. Flushed, dry skin with bounding pedal pulses. 2. Warm, moist skin with irregular pedal pulses. 3. Cool, clammy skin with weak or thready pedal pulses. 4. Cool, dry skin with alternating weak and strong pedal pulses. Answer 3. Rationale. Some of the signs of cardiogenic shock include increased pulse, weak and thready, decreased blood pressure, decreasing urinary output, signs of cerebral ischemia, confusion, agitation, and cold, clammy skin. 188. A nurse is teaching a client about general hygienic measures for foot and nail care. Which instructions should the nurse provide to the client? Select all that apply. 1. Wear knee-high hose to prevent edema. 2. Soak and wash the feet daily using cool water. 3. Use commercial removers for corns or calluses. 4. Use over-the-counter preparations to treat ingrown nails. 5. Apply lanolin or baby oil if dryness is noted along the feet. 6. Pat the feet dry thoroughly after washing and dry well between toes. Answer 5. 6. Rationale. The nurse should offer the following guidelines in a general hygienic foot and nail care program. Inspect the feet daily, including the tops and soles of the feet, the heels, and the areas between the toes. Wash the feet daily using lukewarm water and avoid soaks to the feet, thoroughly patting the feet dry and drying well between toes. And avoid cutting corns or calluses or using commercial removers. Consult a physician or podiatrist for these problems. Additional general hygienic measures include gently rubbing lanolin, baby oil, or corn oil into the skin if dryness is noted along the feet or between the toes. Filing the toenails straight across and square. Do not use scissors or clippers, avoiding the use of over-the-counter preparations to treat ingrown toenails and consulting a physician or podiatrist for these problems. And avoiding wearing elastic stockings, knee-high hose, or constricting garters. 189. A client with renal cancer is being treated preoperatively with radiation therapy. The nurse evaluates that the client has an understanding of proper care of the skin over the treatment field if the client states 2. 1. Wash the ink marks off the skin. 2. Avoid skin exposure to direct sunlight. 3. Apply perfumed lotion to the affected skin. 4. Wear tight clothing over the skin side to provide support. Answer 2. Rationale. The client undergoing radiation therapy should wash the site using mild soap and warm or cool water and pat the area dry. No lotions, creams, alcohol, perfumes, or deodorants should be placed on the skin. Over the treatment site, lines or ink marks that are placed on the skin to guide the radiation therapy should be left in place. The affected skin should be protected from temperature extremes, direct sunlight, and chlorinated water as from swimming pools. The client should wear cotton clothing over the skin site and guard against irritation from tight or rough clothing such as belts or bras. 190. A client with renal failure is receiving Epoetin alfa, Epoetin, to support erythropoiesis. The nurse questions the client about compliance with taking which of the following medications. That supports red blood cell (RBC) production. 1 iron supplement, 2 zinc supplement, 3 calcium supplement, 4 magnesium supplement. Answer 1. Rationale: iron is needed for RBC production, otherwise, the body cannot produce sufficient erythrocytes. In either case, the client is not receiving the full benefit of Epoetin alpha therapy if iron is not taken. Options 2, 3, or 4 are not needed for RBC production. 191. The home health nurse is performing an initial assessment on a client who has arrived home after insertion of a permanent pacemaker. Evaluation of the client's understanding of self-care is evident if the client reports which of the following. 1. I will never be able to operate a microwave oven again. 2. I should expect occasional feelings of dizziness and fatigue. Quote. 3. I will take my pulse in the wrist or neck daily and record it in a log. 4. Moving my arms and shoulders vigorously helps to check pacemaker functioning. Answer 3. Rationale: clients with permanent pacemakers must be able to take their pulse in the wrist and or neck accurately so as to not any variation in the pulse rate or rhythm that may need to be reported to the physician. Clients can safely operate most appliances and tools, such as microwave ovens, video recorders, AM/FM radios, electric blankets, lawn mowers, and leaf blowers, as long as the devices are grounded and in good repair. If the client experiences any feelings of dizziness, fatigue, or an irregular heartbeat, the physician is notified. The arms and shoulders should not be moved vigorously for 6 weeks after insertion. 192. A client with a severe major depressive episode is unable to address activities of daily living (ADL). The appropriate nursing intervention would be to 1. Have the client's peers confront the client about how non-compliance in addressing ADL affects the milieu. 2. Structure the client's day so that adequate time can be devoted to the client's assuming responsibility for ADL. 3. Offer the client choices and describe the consequences for the failure to comply with the expectation of maintaining his own ADL. 4. Feed, bathe, and dress the client as needed until the client's condition improves so that he can perform these activities independently. Answer 4. Rationale: the symptoms of major depression include depressed mood, loss of interest or pleasure, changes in appetite and sleep patterns, psychomotor agitation or retardation, fatigue, feelings of worthlessness or guilt, diminished ability to think or concentrate, and recurrent thoughts of death. Often, the client does not have the energy or interest to complete activities of daily living. Option 1 will increase the client's feelings of poor self-esteem and of unworthiness. Option 2 is incorrect because the client still lacks the energy and motivation to do these independently. Option the third of may lead to increased feelings of worthlessness as the client fails to meet expectations. 194. A nurse is reviewing the results of a sweat test performed on a child with cystic fibrosis, CF. The nurse would expect to note which finding. 1. A sweat sodium concentration less than 40 mEqL. 2. A sweat potassium concentration less than 40 mEqL. 3. A sweat chloride concentration greater than 60 mEqL. 4. A sweat potassium concentration greater than 40 mEqL. Answer 3. Rationale: cystic fibrosis is a chronic multisystem disorder characterized by exocrine gland dysfunction. A consistent finding of abnormally high sodium and chloride concentrations in the sweat is a unique characteristic of CF. Normally the sweat chloride concentration is less than 40 meql. A sweat chloride concentration greater than 60 meql is diagnostic of CF. Potassium concentration is unrelated to the sweat test. 195. The emergency department nurse is assessing a client who abruptly discontinued benzodiazepine therapy and is experiencing withdrawal symptoms. Which symptoms of withdrawal would the nurse expect to note? Select all that apply. 1. Tremors. 2. Sweating. 3. Lethargy. 4. Agitation. 5. Nervousness. 6. Muscle weakness. Answer: 1, 2, 4, 5. Rationale: benzodiazepines should not be abruptly discontinued because withdrawal symptoms are likely to occur. Withdrawal symptoms include agitation, nervousness, insomnia, tremor, anorexia, muscular cramps, and sweating. Withdrawal symptoms from long-term, high-dose benzodiazepine therapy include paranoia, delirium, panic, hypertension, and status epilepticus. 196. The nurse performs a neurovascular assessment on a client with a newly applied cast. Close observation and further evaluation would be required if the nurse notes which of the following: 1. Palpable pulses distal to the cast. 2. Capillary refill less than 6 seconds. 3. Blanching of the nail bed when it is depressed. 4. Sensation when the area distal to the cast is pinched. Answer: 2. Rationale: to assess for adequate circulation, the nail bed of each finger or toe is depressed until it blanches, and then the pressure is released. Optimally, the color will change from white to pink rapidly, less than 3 seconds. If this does not occur, the toes or fingers will require close observation and further evaluation. Palpable pulses and sensations distal to the cast are expected. However, if pulses could not be palpated or if the client complained of numbness or tingling, the physician should be notified. 197. The nurse is caring for a client with a head injury and is monitoring the client for decerebrate posturing. Which of the following is characteristic of this type of posturing? 1. Flexion of the extremities. 2. Extension of the extremities. 3. Upper extremity extension with lower extremity flexion. 4. Upper extremity flexion with lower extremity extension. Answer: 2. Rationale: decerebrate posturing, which can occur with upper brainstem injury, is characterized by extension of the extremities. Options 1, 3, and 4 are incorrect descriptions of this type of posturing. 198. The nurse is caring for a client admitted to the surgical nursing unit following right modified radical mastectomy. The nurse includes which of the following in the nursing plan of care for this client? 1. Take blood pressures in the right arm only. 2. Draw serum laboratory samples from the right arm only. 3. Position the client supine with right arm elevated on a pillow. 4. Check the right posterior axillar area when assessing the surgical dressing. Answer: 4. Rationale: if there is drainage or bleeding from the surgical site after mastectomy, gravity will cause the drainage to seep down and soak the posterior axillary portion of the dressing first. The nurse checks this area to detect early bleeding. The client should be positioned with the head in semi-Fowler's position and the arm elevated on pillows to decrease edema. Edema is likely to occur because lymph drainage channels have been resected during the surgical procedure. Blood pressure measurement, venipuncture, and intravenous sites should not involve use of the operative arm. 199. The nurse is assisting the client with hepatic encephalopathy to fill out the dietary menu. The nurse advises the client to avoid which of the following entree items that could aggravate the client's condition. 1. Tomato soup. 2. Fresh fruit plate. 3. Vegetable lasagna. 4. Ground beef patty. Answer: 4. Rationale: clients with hepatic encephalopathy have impaired ability to convert ammonia to urea and must limit intake of protein and ammonia-containing foods in the diet. The client should avoid foods such as chicken, beef, hump cheese, milk, peanut butter, and gelatin. The food items in options 1, 2, and 3 are acceptable to eat. 200. A client with a colostomy is complaining of gas building up in the colostomy bag. The nurse instructs the client that which of the following food items should be consumed to best prevent this problem. Select all that apply. 1 yogurt, 2 broccoli, 3 cabbage, 4 crackers, 5 cauliflower. Answer 1, 4. Rationale: consumption of yogurt, crackers, and toast can help to prevent gas. Gas-forming foods include broccoli, mushrooms, cauliflower, onions, peas, and cabbage. These should be avoided by the client with a colostomy until tolerance to them is determined. 201. A client receiving parenteral nutrition (PN) complains of nausea, excessive thirst, and increased frequency of voiding. The nurse initially assesses which of the following client data: 1. Rectal temperature, 2. Last serum potassium, 3. Capillary blood glucose, 4. Serum blood urea nitrogen and creatinine. Answer 3. Rationale: clients receiving PN are at risk for hypoglycemia related to the increased glucose load of the solution. The symptoms exhibited by the client are consistent with hypoglycemia. The nurse would need to assess the client's blood glucose level to verify these data. The other options would not provide any information that would correlate with the client's symptoms. 202. A client admitted to the hospital with a diagnosis of cirrhosis has massive ascites and difficulty breathing. The nurse performs which intervention as a priority measure to assist the client with breathing? 1. Repositions side to side every 2 hours. 2. Elevates the head of the bed 60 degrees. 3. Auscultates the lung fields every 4 hours. 4. Encourages deep breathing exercises every 2 hours. Answer 2. Rationale: the client is having difficulty breathing because of upward pressure on the diaphragm from the ascitic fluid. Elevating the head of the bed enlists the aid of gravity in relieving pressure on the diaphragm. The other options are general measures in the care of a client with ascites, but the priority measure is the one that relieves diaphragmatic pressure. 203. A nurse who practices culturally sensitive nursing care recognizes that. Select all that apply. 1. The expression of pain is affected by learned behaviors. 2. Physiologically, all individuals experience pain in a similar manner. 3. Ethnic culture has an effect on the physiological response to pain medications. 4. Clients should be assessed for pain regardless of a lack of overt symptomatology. 5. The use of a standardized pain assessment tool ensures unbiased pain assessment. Answer 1, 3, 4. Rationale: pain and its expression are often affected by an individual's ethnic culture in ways that include net means of pain expression, the physiological response to pain medications, and attitudes regarding acceptable ways of dealing with pain. Physiologically, not all individuals, even those of the same ethnic culture, will respond to pain in a similar manner, and so a standardized pain assessment tool is not effective in measuring pain in all clients. 204. Place in order of priority the steps that the nurse takes to measure a client's oxygen saturation via pulse oximetry using a finger. Number 1 is the first action and number 5 is the last action. Blank. Perform hand hygiene. Blank. Place the probe on the appropriate finger. Blank. Record the oxygen saturation level. Blank. Check capillary refill in the proposed measuring site. Blank. Position the hand in a comfortable, supported position. Answer 1, 4, 5, 2, 3. Rationale: to minimize the risk of cross-contamination among clients, the nurse must perform hand hygiene before and after any client contact. Determining appropriate site includes assessment of circulation reflected in a capillary refill time of 3 seconds or less. In preparation for the actual testing, the hand and arm should be placed in a comfortable, supported position to minimize muscle motion that might interfere with the testing, and then the probe is placed on the predetermined finger. The nurse then documents the oxygen saturation level. 205. The nurse provides discharge instructions for a client beginning oral hypoglycemic therapy. Which statements, if made by the client, indicate a need for further instructions? Select all that apply. 1. If I am ill, I should skip my daily dose. 2. If I overeat, I will double my dosage of medication. Quote. 3. Oral agents are effective in managing type 2 diabetes. 4. If I become pregnant, I will discontinue my medication. 5. Oral hypoglycemic medications will cause my urine to turn orange. 6. My medications are used to manage my diabetes along with diet and exercise. Quote. Answers 1, 2, 4, 5. Rationale. Clients are instructed that oral agents are used in addition to diet and exercise as therapy for diabetes. During illness or periods of intense stress, the client should be instructed to monitor his or her blood glucose level frequently and should contact the health care provider if the blood glucose is elevated because insulin may be needed to prevent acute hyperglycemia symptoms. The medication should not be skipped or the dosage should not be doubled. Taking extra pills should be avoided unless specifically prescribed by the healthcare provider. These medications do not change the color of the urine. Medication should never be discontinued unless instructed to do so by the healthcare provider. However, the diabetic who becomes pregnant will need to contact her healthcare provider. Because the oral diabetic medication may have to be changed to insulin therapy because oral hypoglycemics can be harmful to the fetus.